Hello, my name is Kai. I'm a non-binary trans guy and I use he and they pronouns. I wanted to talk a bit about the consultation process for top surgery in Ontario because it's a resource I would have liked to have had access to before I actually went through the consultation process. There are some videos out there, but they're mostly for like America or like the UK areas, or I guess there's some in other languages that I don't know how to speak, so I can't attest to their accuracy. But this one is for Ontario in Canada. Before the actual consultation, around a little over a year and a half before, I went to the doctor to get like a note and have the insurance request forms filled and sent out. They took only a couple months, like maybe not even 3 months, to get approved and then sent off to the surgeon of my choice, which would be a local surgeon that because I can't drive and I don't feel like taking a train after surgery. So I'm going to get it done locally. But for the actual consult itself, it was about, like I mentioned, a year and a half wait. I just got it a couple weeks back. I was calling the secretary every couple of months, being like, "Hey, where on the list am I? How long do I gotta wait?" And eventually, she was like, "Oh, like you're at the top. I can just bump you up a tad and see you in the end of the month." And I'm like, "Yeah, okay, yeah, let's do that." And she's like, "Cool, we're good." So then when the day actually arrived, I went in the waiting room. I didn't have to fill anything out at that point. I just kind of took my number and waited. And then the nurse came to get me, brought me to the room, and asked me to change into the gown. And he left the room for that, so I didn't have to get changed in front of anyone. So he came and asked a bunch of questions, such as like how long I felt dysphoric about my chest for, what pronouns I used, which was actually really nice to be asked because it made it feel like a really good environment to, get a transition related surgery. Um, they also asked for like height, weight, what I think my chest size is, if I had any history of breast cancer, did I smoke? Did I drink? That sort of thing. What medications I was on, which I just brought in because it's easier to just bring them in than just say anything, I think. And actually, he forgot a lot of the questions because he left and I could hear him talking to the surgeon in the other room outside the door. And she was all like, "Oh, you have to ask about like pronouns and history and like do they have any like supports in their life and all that." So he came back and I just answered all the questions before he said anything. And I was like, "Yeah, I heard you outside." So I thought I would just make your life easier and answer them right away. And he's just like, "Okay, cool." And that was that. Um, yeah, I asked if I had any questions. I asked about drains, which apparently we are going to use drains. So that's something to look forward to, I guess. That fluid change and all that. I'm like kind of interested in how it smells or even what it tastes like. I'm not going to drink it obviously, but it's kind of like forbidden juice, you know? Like that's kind of weird, but I don't know, I'm just curious. I'm just a curious little guy. Um yeah, after that, the part I was dreading the most, the physical exam. Honestly, it wasn't that bad. It was only about maybe 2 to 3 minutes. Um, I did have to be topless, and I had to sit like proper, no slouching, shirt pulling trans posture. If you know, you know. Um, yeah. So the surgeon, she would measure different aspects like sternum to the nipple and then like nipple to the bottom crease. She like moved things around to test for elasticity, look for stretch marks or scarring, anything like that. And she would just give off these fancy medical terms that the nurse would write down the numbers for. The only one I remember is that I have grade 1 nipples, which after I Googled it, apparently means they're kind of pointy. I think it's like the default reaction of nipple. I don't know how to explain that, but it's the only thing I remember because I was just listening to that to distract myself from the fact that I was shirtless in front of some strangers and like I don't want some randos seeing that. I don't want anyone seeing that. But they made it a very good environment, so it was significantly less awkward than it could have been. After all that, she said I was a very good candidate for double incision, which is, if you're not familiar, it's when they make an incision both above and below all the tissue, take it all out, including your nipple. They just kind of put that on the counter on the side or something, and then they pull the skin tight against each other to make one line right under your pectoral. They put the nipple back on, or you can leave it off if you want, but it's the one you usually see with the two big scars underneath each side. That's the most common one that you had to get, especially if you have a larger chest size. But yeah, she said I was a good candidate for that and that it should go smoothly and I should heal well based on how my skin is. Apparently I have good skin. Cool. She also talked about how to avoid getting dog ears, which is when the ends of your scars have like tissue hanging out or puckering out over it, like little tags. Usually that happens if you have more tissue to remove or just based on how your healing is. People can get it revised. But she said that she was going to do the scar in such a way that it will minimize the likelihood of that happening, which is pretty cool. Yeah, I didn't get an actual date though. She said it could be anywhere from 6 months to a year, tops, but that'll likely be sooner because I waited so long for the consult and because I signed up for the cancellation list. So if anybody cancels or has to reschedule an appointment, I can get their spot. They can just call me and be like, yo, can you come in like a week or a few days or whatever? And I'd be like, yeah, of course I will. I could be in the middle of work and I'd just leave. I'd be like, peace out, y'all got surgery. And they would be like, okay, cool, good luck, because they're pretty chill. But yeah, that's about everything. So I've done everything that needs to be done. I've done all the paperwork. I've done all the stuff. So I just gotta wait. And then this year, sometime this year probably, I'll be flat. I'll be comfortable with my own skin. And I won't have to bind, because like binding's annoying and sweaty and it's a pain. Well, not, it shouldn't be painful, but like sometimes I wear it too long. But I'm really looking forward to being comfortable with at least that part of myself. It's going to be a feeling I've never really felt, and I desperately want. I will probably update maybe once I actually get this done. So if you're interested in sort of that deal, that's something to look forward to. I know I will be. That's it. Bye.